Okay, so Hariom everyone. We'll start the class. We'll start the session. My this voice and screen is audible, visible.
Ma'am, screen is not visible.
Okay, one second. Now is it okay? It is visible.
Yes, ma'am.
Okay. So yesterday what we have studied is one of you repeat it. Fast.
Only yesterday's, ma'am.
Yes, yesterday's what we have studied.
Okay. Okay. We have studied this chronic bronchitis.
Yes.
Yeah. So in chronic bronchitis, it is basically a lung condition. Sorry,
Okay,
ma'am.
okay, okay.
Are you saying
I'm
something?
just asking about what topics like only chronic bronchitis we had gone through, no?
Sinusitis
Ma'am,
Also
also, ma'am.
same.
sinusitis and yes, ma'am.
Yes, sinusitis also. That's why I'm asking. So now today the last respiratory disorders we have done with all the 3 or 4 respiratory disorders. The last one is your bronchial asthma. Hmm. Bronchial asthma, which is again one of the respiratory disorder. So what is bronchial asthma? Recording is started now.
Yes, ma'am.
Okay, so bronchial asthma, what is bronchial asthma? It is a condition characterized by the recurrent, like again and again, attacks of difficulty in, so person feels difficulty in inhalation and exhalation when there is recurrent attacks of these or reversible again and again it is happening due to the narrowing down of the passage, narrowing down of your airways, bronchial passage. Then it is known as your bronchial asthma. Hmm. So you will say that in bronchitis also the same thing is happening. The narrowing down of the passage is happening because we are studying about respiratory disorders. All the respiratory disorders will some or other way similar to each other, but not same. So when in bronchitis also, bronchitis is a kind of a little in the form of acute. Okay, in acute condition, this for short time. But this bronchial asthma is a chronic condition. You can even say sometimes it is colliding. Okay, symptoms are also similar, everything is similar, so we can even wrongly identify bronchial asthma bronchitis as a bronchial asthma because it is very much similar. But bronchitis is a little acute as compared to that of bronchial asthma because it is an ongoing condition which continues for bronchial asthma is an ongoing condition which continues for long period of time, and person is regularly taking medical treatments for it. So bronchial asthma or asthma is a lung disease. Your airways get narrowed or swallowed and a blockage is there due to the excess mucus similar to that of bronchitis. Due to excess mucus, this is your airways or bronchioles. There is excess mucus in your airways. The airways is getting short, like a little thinner for air to pass through it. Therefore, this bronchial asthma is happening. There is difficulty in inhalation and exhalation. When recurrent and again these attacks are coming, this condition is called as bronchial asthma. Asthma also called, this bronchial asthma is also called as bronch asthma. Okay, so same. Asthma, also called as bronchial asthma, is a disease that affects your lungs. Chronic, this same thing which I am telling you. This is a chronic ongoing condition which continues for long period of time, meaning it doesn't go away and needs an ongoing medical condition to stay. Like people takes in nebulizers and these inhalers. Most common is inhalers they are used to taking. So always like, for long time they are taking that. So it continues like that. So asthma effects, this is nothing, a little data about that. 20 out of 25 million people in the US currently have the asthma. Out of that, most like 5 million are approx of the children's. All this is because of air pollution and all. Also, some in some cases we'll see in the further slides what are their causes. So asthma can be life threatening, as I told you. It is most chronic. We can even say the chronic condition of bronchitis further developed into the this bronchial asthma. So it is life threatening. The person can even get die because of this. Hmm. Here you can say that you can see in the diagram that this is where red pen is coming. This is the mucus production and mucus accumulation, which is narrowing down the passage, and there is constriction in your airways. When there is sudden some constriction or spasm or contraction in the muscles happens, the person feels that sudden thing is known as what we called it as a asthma attack. We say na asthmatic attack. Person got asthmatic attack like that. Okay.
Ma'am, any
So
reason for this many cases in US?
yes, ma'am. I couldn't hear you.
Yeah, yes,
Can you
ma'am.
repeat again?
I was asking any particular reason why US people have more this condition?
No, I just taken this as a data. Out of when I am seeing that, not like that. I didn't know why so, but when I'm seeing that data, I saw this that mostly it is happening in there. So sorry for that.
India, India have more pollution now, ma'am. So that's why I think
Yes,
Rajesh ma'am is thinking
that's
of
why
why you. Yeah.
maybe their uses of the matlab, virus attack is more, or use of the substance abuse and all like that. Okay, because that I think so. There it is more substance abuse and all smoking. All. So this is only the data I have taken. Now this thing is important. Symptoms and again further we'll see symptoms also, that will also be not much important. The thing exactly is what exactly is happening in the problem. This one is important, and then this thing is also important, which we are going to because this is very important. Actually, we can say these are the three reasons why it is happening. So you can see it is written that muscle when you breathe normally, when you normally breathe in, what exactly happens? These are our airways. When we are normally breathing in normal condition, in the healthy person, these nearby muscles are normally relaxed. Okay, in relaxed conditions, letting the air normally to go inside. Okay, easily air could go inside and can come outside. Okay, in the form of the carbon dioxide easily. So, but during the asthma attack, what happens? Three conditions happens. What first is bronchospasm. The word spasm itself says spasm, something constriction or something contracting. Spasm word itself means something contracting, but and broncho in front is there means some bronchial tubes. Okay, so when there is constriction in the muscles around the airways, this is our airways. When these muscles will get constricted, it will definitely, when there will constriction in this, it will definitely going to press these walls inside. So again the passage for the air will be decreased. Passage for the air to travel inside will be decreased. So again the narrowing down, one reason for narrowing down these of passages, the around the muscles around the airways will get constricted or tightened. Hmm. Air cannot so easily, it is easy that air cannot be flow freely through these constricted airways, further leading difficulty in inhalation and exhalation. So first reason is bronchospasm. The one thing, only one word answers I want you to learn. Bronchospasm. What is happening in this? Constriction is happening, due to which tightening in the walls and the airways get narrow, and same difficulty in exhalation and inhalation. Then next is inflammation. Inflammation is same as in bronchitis. Okay, inflammation is happening in your bronchial, in mucosal layer of your bronchial tubes, and then again narrowing down the passage. Exhalation and inhalation is difficult. Hmm, the same. So lining in the airways becomes swollen. When swelling is there, so this swelling will air, let air. It makes difficult for air to in and out. Now mucus production, as I told you, as a reaction to some stimulus which is coming out from outside, or which whatever stimulus is provided to our body, as a reaction to it, body start protecting. In the language of body, what usually it happens, it produces mucus, or as told you, inflammation will happen and reddishness will happen. All these are the symptoms which body shows. So when excess mucus will be there, again if mucus deposition will be there, the narrowing down of the passage will definitely going to happen. Okay, so again difficult inhalation and exhalation. So in these scientific words, you will learn what three things happening: bronchospasm, inflammation, and mucus, excess mucus production is there. Okay, these three reasons could be there in muscles. Okay, now types of asthma, or you can say classification of the asthma, same. So first of all, we are saying on the basis of severity of the symptoms. Okay, how severe it is. So intermittent, with the name itself we can see intermittent. We can understand it that in between it will happen. This type of asthma comes and goes, so you can feel normal in between. So the asthma attack will come, or asthmatic attack, or anything asthma related problem, inhalation exhalation problem will happen in some days it will be normal. After that, some days it will be normal. Again the asthma attack may can happen, or difficulty in inhalation and exhalation could happen. So, okay, so it comes in between. Intermittently it will happens. Now persistent word itself says regular. Persistent asthma means you have symptom most of the times in the year. Most of the times you will have the symptoms. Symptoms could be, and these intermittent and persistent symptoms also could be mild, moderate, or severe. It depends upon person to person and condition to condition. Okay, patient to patient. So this is on the severity of the symptoms. Very simple, very simple, intermittent and persistent. Okay. Now times of attacks, on the basis of times of attacks. Seasonal it will happen with the name itself, very easy. Occurs particular season and patient is free from the attack. Throughout the whole year it will be free, and in particular seasons it could happen. Perennial, where this word perennial we have particular thing throughout the whole year.
Allergic rhinitis. Rhinitis, no?
Yes.
Allergic rhinitis
Yes,
has
yes.
been done.
Very, very good, very good, very good. So you people are like remembering. It's good. So perennial, again throughout the whole year. Attacks could happen throughout the whole year. Now irregular is intermission throughout the year. Like in between, it could again happen irregularly, not at the regular interval. It is not like that. It can happen anytime, but irregular. May happen, may not. Now pathology, nothing
Is
same.
it related to
Inflammation, mucus
sporadic?
buildup in the airways, reducing the space. Yes, ma'am.
Is it like the
Yes,
last
what are you
one?
saying?
Irregular. Am I audible properly? Am I audible now?
Yes, a little your voice is breaking. Yes, 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 yes.
Okay, I was just asking that irregular is related to sporadic one, or it is something different from it.
Yeah, yes, yes. Because it is sporadic one is related to intermittent. This one, I want to ask this question at this intermittent one, because intermittent, I told you, sporadic means what does sporadic mean? Who will tell?
Occurs
Yesterday you
occasionally,
told.
ma'am, intermittent only.
Because intermittent word is opposite of sporadic actually. Intermittent is sometimes. Sporadic is like regular. No, it is not in regularity. The word I said for sporadic is not in regularity. So therefore intermittent. Intermittent is related to sporadic. Now pathology, this is very same what we have said, but just to show you in a diagrammatic view, because when we see the diagrams, it is very easy for us to remember. Otherwise, in reading, learning, it is not easy to remember for the long time. So in the diagram, you can completely see this and then recognize at the time. So what happened in the normal condition? There is a big space for airways in the airways. for inhaling and exhalation. Okay, because the nearby muscles, these brown color are the muscles. Okay, because nearby muscles are here in this condition, nearby muscles are relaxed in relaxed position. Okay, but what happen in asthmatic airways, these if first of all this inflammation and all is happening, so due to which the small area, the area becomes small for air to travel in and out. These muscles also get a little constricted or inflamed, you can say. And in this condition, in condition of attack, okay, asthmatic airways, during the attack, what will happen, this airways become more, the muscles will also tighten, inflammation is also there, mucus production is also there, so very less space. This very less space condition is called, sometimes when we say sudden attack has happened, so sudden attack or sudden difficulty in exhalation and inhalation will lead to it. In this tightening of the smooth muscles, as I told you, what is the three reasons I told you, what this tightening of the smooth muscles will come under which reason? Three reasons we have studied before this, na? I told you bronchospasm,
This is
mucus.
bronchospasm, ma'am. Inflammation.
Yes, this tightening of smooth muscles will related to bronchospasm. Okay, constriction because is happening, so tightening of the muscles happening, due to which narrowing down of the passage. Very easy. Understood? We can go ahead.
Yes, ma'am.
Okay. Now asthma triggers. What can trigger asthma? Not so
Ma'am?
important. Still, we'll see.
Ma'am,
Yes, ma'am.
can you go back to this once
Yes.
again? In that also we have just we did that because of wall inflammation, those smooth muscles were tightened, right? That's the reason it is called inflammation only. Can't we say that it is happened because of inflammation?
This inner, what happening na, outer, one reason is outer walls, on the outer walls the nearby muscles are getting tightened. Okay, one reason is that. And in inner mucosal membrane, you must have studied in anatomy that every organ of our body, inner wall is called as inner mucosal membrane. So this inner mucosal membrane, excess mucus is producing, and then inflammation is also there, so these get more thickened. Due to inflammation it is getting thickened. And also in third condition I told you na, in this one, third reason I told you na, mucus production is there as a reaction to the stimulus coming from outside. Okay, so these two things could happen here, inflammation and mucus production, both could happen. Okay, in this one. Okay, ma'am. And outer one
Okay.
is tightening of the
Ma'am, I
muscle.
have a question.
Yes,
Hello?
yes, sir.
Ma'am, I have a question. What does pathology mean?
Pathology means what causes it exactly.
Causes.
Okay. Yes. Matlab it actually it says that what is cause and effect. Matlab what is causing it and what effect it shows. Okay. Cause and effect of the
Okay.
disease. It actually, the word is
Diagnosis.
scientific word. So this is pathology is exactly actually the science. This is the science that show us this cause and effect. Okay. Science of the cause and effect. Exactly. Exact word for pathology is science of cause and effect. How it is causing and then what effect it shows. Okay, asthma triggers, this is not so important, but still you can read and study. Okay, allergens can trigger asthma, virus infections, mostly virus, most like common virus for all the respiratory disorders. Many viruses could be there, but most common I'm telling is rhinovirus. We used to say. I have searched that. Then drugs, exercise, low exercise when you are not doing exercise and all. Food also, sometimes you are allergic to those. Okay, stress, how stress is. So for stress, I will say that you are the yoga students. Okay, of course, you know about the concept of Adi and Vyadi. You know, na? When we see yogic management, then also we have to go through this only. So first we can understand. So in Adi, what is the Adi? Can anyone tell?
Ma'am, mental affliction. Adi means mental affliction, Vyadi means physical affliction.
Yes, yes. mental application. Yes, Vyadi is physical
Ma'am,
application.
they
So what
say
happens in
they,
mental whenever we have, yes, ma'am, voice is
ma'am,
not
I was
audible.
saying asthma. Am I audible now, ma'am?
Yes, yes, yes.
Yes, ma'am. So at the mind level, they say uncried tears for years is asthma, ma'am.
What? Not clear.
I think your internet is unstable, ma'am. They say at the mind level, uncried tears for years is asthma, ma'am.
Okay. 1 second. If my voice is my voice is also breaking, so I will change my
No, ma'am.
Wi-Fi. Clear?
Your voice is not breaking, ma'am, but I think you are getting our voice late.
Okay. Maybe. Should I change my Wi-Fi or is it okay like this only?
It is okay
Now
when you
it
are
is okay.
speaking.
Okay. Okay, ma'am. So at the last, I will take your questions. Okay, I'm not even understanding. So I want to complete one more disease today. So, hmm.
Okay, ma'am. Okay.
So signs and symptoms, you can go through this. Okay, signs and symptoms not so important, but still I have taken very simple, same, similar chest pain and weakness and this mucus production, dyspnea. This word dyspnea means shortness of breath. Okay, very simple. Usually we used to say it is not written here this word now. Usually these symptoms of asthma are visible if it is normally happening to the person. Problem is asthmatic person. Usually symptoms are visible at the night and in the early morning. It is also one of the hyperresponsiveness. So when our bronchial tubes or bronchial tubes are showing hyperresponsiveness to the stimulus like allergens or all these causing factors which we have seen. Okay, very hyperresponsive or easily get affected by these infections and all. Then this sensitivity, this increase the sensitivity to the wide variety of airways narrowing stimuli. So due to when our airways are hyper responsive, which means when the stimulus will come from outside, it will be very sensitive that easily get affected by it and will get narrowed down. Not so important, but still to show make you understand the hyper responsive word, I have given this here. So narrowing down of the passage will happen due to hyper responsiveness also. Okay, so due to bronchial hyper responsiveness, if our body is like if our bronchioles are hyper responsive, that it get easily affected by all the external factors, it also then also it get narrowed down easily and difficulty in breathe in and out. This word not so important still, because the only disease is main important for you. Still we are studying, so we can see this status systematicus. I have kept this because very easy, not so big. Na? Status systematicus, what is it? Does it means the attack continues for more than 24 hours despite administration of bronchodilators. What are bronchodilators? Constriction word means contraction. Okay, dilators, bronchodilators is the medicine. Okay, medicine we used to take. Bronchodilator, if there is constriction, bronchodilators are given so that to dilate means to freed up this passage to make it more big. Okay, so this constriction will be removed and to dilate this passage, bronchial passage, dilators are given. So this is, you can understand, this is a medicine for this airways problem. Okay, so even on going giving these medicines, but the condition or this attack or this exhalation inhalation difficulty is happening for more than 24 hours, even on going giving these bronchodilators medicines, this condition is called as status asthmaticus. Okay, and severe form of the asthma, this is status asthmaticus, severe form of the asthma in which the airways obstruction is unresponsive to usual drug therapy, can lead to respiratory failure, because this is the very, because our our system is getting unresponsive, is not reacting or not affected by any of the drugs or any of the medicines. This is very, of course, definitely it will be very chronic condition, which can lead to respiratory failure also. So status systematic is more than 24 hours. Simple terms, more than 24 hours continues even on taking bronchodilators or other medicines, drugs related to it. It is unresponsive of them. Prevention, not so important for your purpose, but still keeping house clean because it will not get other dust and all. Getting rid of the pets, avoiding allergic and maintaining the room temperature. Very easy. Causes of the asthma. Allergies, have allergic to um, can raise your risk of developing asthma, like allergies to different things which we have studied before classes. Okay, environmental factors could also be the one of the reason people can develop asthma on exposure to things like irritants, or we can say allergens. These substances are called allergens, toxins, fumes, etc. Anyone could be allergic to anything. You don't know, depends on person to person and their immune system. These can be especially harmful too. So these allergens could be especially harmful to infants and young children, where their immune system is not completely developed. Okay, as I told you, everything is related to immune system. Now, genetics, it could be genetic factors also, and respiratory infections. If any specific infections will be there, it could lead to asthma. Medical management, bronchodilators, I had told you before only. Nebulizers, in nebulizers, what exactly happens? This liquid medicine is converted into steam and go inside through our mouth and nose. And inhalers, it is very common nowadays. So with this, we have completed with our bronchial asthma. All the respiratory disorders now completed. All together, their management we are seeing now. Okay. Yogic management of respiratory disorder. Okay. Now we'll go for the yogic management of all the respiratory disorders all together. So as I told you in starting, first day, in syllabus, I have told you one word, which is yellow mark. And I told that only this syllabus slide I made for this line. What word that is? What is exactly that sentence line? Can anyone recognize or remember?
Sorry,
My
ma'am,
voice
what
is
it
audible.
was?
It's first day when I have showing you that syllabus. I told you that I put this syllabus slide only for this one line to make you understand this. That anyone remember? Okay, that is integrated approach of yoga therapy. Okay, IAY. Sorry for writing. And IAYT, integrated approach of yoga therapy. So what involves integrated approach? I told you that very first day, that integrated approach of yoga therapy means we are working on each and every koshas of the body. How many koshas are in the body? Can anyone tell?
Five, ma'am.
Fast, fast,
Five,
fast.
ma'am.
Yes, five
Five,
koshas.
Five,
So
ma'am. Five.
when we are working in all the five koshas, all the five sheets of our body, these type of therapies are called as integrated approach of yoga therapy. So like we'll go for first, we are taking annamaya kosha. Therapy is very easy, simple, all the asanas which is related to chest opening asanas, everything like that. But in this IAYT module, or in this form of IAYT manner, I want to show you. Okay, annamaya kosha first will go. First kosha is annamaya kosha, which is stool body, or we say gross body, just visible to us. This body is visible to us, na? So this one is annamaya kosha. So in annamaya kosha, what comes? Diet, because diet is only will give us this physiological aspect also, internal one also. So simple sattvic vegetarian diet, mostly for all this, build immunity. Kapha reducing, why? Because in every, like in all the respiratory disorders, we are seeing that mucus development is happening. So we should go for the kapha reducing diets. Have you all done Ayurveda?
Not it, ma'am.
Ayurveda is complete.
Not.
Not yet. Okay. So when you will study that rasana, rasas, all the seven rasas, then you will see this katu, tikta, kashaya. Okay. So there are seven: madhur, amal, lavan, katu, tikta, kashaya. Madhur, amal, lavan, katu, tikta, kashaya. So this is not my subject, but very easy to learn, you know. So this katu, tikta, and kashaya, these we should take for cough reducing. Okay. And those who have bath reducing. Okay, this they will tell only. Okay, Vat is rukshness, so Vat people should go for this. Is and Katu Tikt Kashaya. Main my focus is Katu Tikt Kashaya. What is Katu? Katu means Katu word says that it is bitter, but it is not bitter. It is spicy. Katu means here spicy. Tikta means bitter. Kashaya means a little pungent type of taste. I think amla, like that. Okay, so Katu Tikta Kashaya is a kapha reducing diet or foods. So we should go for them. Then avoid Rajasic and Tamasic food, the foods which increases the your activity. These are Rajasic food, and Tamasic foods are which increases what alasya. What we say? I'm not getting this word. Laziness to you. Okay. Now, loosening exercises, of course, in Annamaya Kosha, what happens? We take diet and asanas. Okay. In Annamaya Kosha, diet and asanas will come. So, in asanas, first loosening practice, very simple. All the joints loosening, then strengthening, um, strengthening practices, breathing practices. All these will come in the loosening practices of this chair breathing, etc. Then further will comes asanas. Okay, in these losing practices, after losing practice, we used to go for asanas in systematic manner. We go through this pattern only. Okay, otherwise we do and we can do anything anytime. Okay, so Ardha Chakrasana, you will see the pattern of the asana. All will be chest opening because we are going through the respiratory disorder, which is related to lung problem. So maximum asanas which are related, which are chest opening asanas, we used to go for that. Okay, this asanas which are we have given, these are for respiratory disorders, lung problem, but maybe person have merging problems. Okay, have hypertension also and this also, so you have to manage that according to that, but usually for only respiratory disorders these asanas are given. Okay, then Padhastasan, Shashankasan, Ushtrasan, again chest opening, Ardhmatsyendrasan, again your chest will open, Bhujangasan, hmm. Then Shalabhasan, Dhanurasan, Matsyasan, Setubandhasan. Hopefully you all know about these asanas. When if you are yoga students, of course you know. No need to explain more. Now Kriyas. Kriyas are Shat Kriya. So Neti will Neti, you all understand that there are two types of Neti, Sutra Neti, Jal Neti. So Neti is moreover, it will be very good for allergic rhinitis because we are having problem or mucosal accumulation in nasal passage in allergic rhinitis. So, if there is any surgery, like for deviated septum, also people used to go for surgery if it is a severe condition. So, if any surgery, we can avoid it. Otherwise, Neti is very good practice for that. For all the eyes, if you have studied Hatha Yoga Pradipika and all, also you know the benefits of Neti and all. You have studied, gone through the Hatha Yoga text,
Yes, ma'am.
Yes,
HYP
ma'am.
is done.
so you know very well. Neti is better for dry nose also. Now, Dugdha Neti is with the milk. Better for allergic rhinitis because more sensitive to milk. Now, dhoti again to remove the cough from your lung region because these respiratory disorders are divided into, as we have started from allergic rhinitis in the upper respiratory tract. I had told you that day, and other diseases in the lower respiratory tract, which are like bronchial asthma, bronchitis, lower respiratory tract. So we have to clear all over whole respiratory tract. Dhoti to remove the cough again. Kapalabhati. Sometimes people study this in the pranayam because Swami Ramdev ji have given it in the pranayam. Otherwise, it is the one of the Shat Kriya only. Okay, not in the pranayam. So we studied in the Kriya. So if you have studied Hatha Yoga test, you must know that Kapalbhati is very good to remove all the 20 type of the kaphas. So Kapalbhati and very easiest also. Then Shank Prakshalan to overall cleansing of your body. Now pranayam. So first we have gone through Annamaya Kosha, and we have completed our Annamaya Kosha with diet and all the asana practices, loosening and all. Okay, and kriya also, shat kriyas also, because that also we are doing with physical body. So all will come under Annamaya Kosha. Now Pranamaya Kosha. In Pranamaya Kosha, pranayam will come definitely. So all the pranayams will come under Pranamaya Kosha, because taking care of our pranas, taking care of the air which we are taking in and out is pranamaya kosha. Okay, so vibhagaya pranayam, which means vibhagaya pranayam is in the word sectional breathing we used to call in English. Okay, sectional breathing, in which what happened in sectional breathing, first we used to go abdominal breathing, then we used to go thoracic breathing, then we used to do clavicular breathing, and then full yogic breathing, that means all together. Then Nadi Shodhan, Anulom Vilom also we used to call in common language. Ujjayi Pranayam to remove again kapha. Brahmari also to remove your kapha. Pranamaya Kosha. Then Manomaya Kosha. Manomaya Kosha is related to mind. Okay. So for this we'll use to go for meditations, dharana, dhyan and meditations. Okay. Meditations are there. You will study in other subject, I think so. Last unit, I think that is. No, other meditations are there to relax the person mind. As I told you, Adhi causes the Vyadhi. So when a person have mind stress, which is physiological, which is visible on the person's body. That's why what happens when we take too much stress in our life, very much stress of any of the personal problem or exam problem, anything. Then if we take stress, too much stress, it will lead to fever in our body. So what is this is exactly one of the we used to get fever next of the RD, we are having mental stresses or mental destruction, which will lead to physiological destruction, which is physiological destruction, which is visible to us. Fever, we are getting fever. Okay. So this is how. Now third is Vijnanamaya Kosha, which is something related to our intellect. So in Vijnanamaya Kosha, so how we'll treat the person with the matlab, we'll treat the Vijnanamaya Kosha of the person. So we'll give them lectures, we'll make them understand about, or counseling, yogic counseling is there. How will someone who is not practicing yoga, how will influence him to do yogic practices? So that is called as yogic counseling. How will let him know first, then awareness programs. So what it happens, will go to them, or if the patient will come to us, how will make him confident about that, yes, yoga will work. So first we will tell him about his disease, how it is causing, how it is getting okay with the medicines or allopathic medicines, and what should be done, and what are the their disadvantages, and how can we naturally remove that. All this will tell what is exactly your disease is. And if we'll do this asana, if the person is having diabetes, if we are twisting our body in Ardha Matsyendrasana, if we'll recognize them by closing their eyes, we'll recognize them, remember, like think that insulin is releasing, it is going to the all the body part, it is now releasing with every twist, everything will tell them. So like that we can counsel their mind. Okay, to do yoga practices and how it will work. Okay, yoga counseling is there. And then Anandamaya Kosha, last Kosha. In Anandamaya Kosha, we used to, like, because as I have studied from SVASA, we used to give them happy assemblies and Karma Yoga. So what happened in happy assemblies? Nothing but different games they used to play, or normal. Because what happened, I told you that this all is happening. The main cause for everything is stress. So people are stressed when they come for the treatment, and there they have this environment of happiness, togetherness, everyone is talking to them. Maybe the disease is because of the person is not getting time from their family members, and this stress will cause this further diseases. So again, when they come together and they treat themselves and see that games, these little games and everything will let them to involve in this, and they will get a little happy. This happiness itself will reduce their stress, and their problem will also be somehow released. Okay, then Karma Yoga. In Karma Yoga, do all the activities like different small activities, putting plants and all like that. So with this yogic management of respiratory disorders is completed. Shall we go for? I thought that we'll go for next disease also. Is it okay for everyone or any doubts?
Okay, ma'am.
Okay,
Ma'am,
because very easy. Yes.
ma'am, that today we started that bronchial asthma. Is it primary cause of chronic bronchitis? What we started yesterday?
You are asking what is the difference between them in.
No, no, ma'am. I am asking. Means what we started today. Bronchial asthma is or bronchial asthma. Is it primary cause of chronic bronchitis?
Yes, I told you na in starting itself that bronchial asthma and bronchitis are very much similar. Okay, very much similar. So what happens? We can say that because we have studied in classification of bronchitis, there is acute and chronic. Okay, usually bronchitis is a little acute or short term as compared to that of bronchial asthma. And one word is ongoing. This asthma is ongoing condition on the medical treatments. Okay, this is ongoing. This continues for long period of the time, and we can even say that chronic bronchitis is itself converted to bronchial asthma or much more similar to bronchial asthma. Chronic bronchitis itself can be bronchial asthma. So I told you that it is very much wrongly identified. Some people that it is same. Understand?
Yes, yes, ma'am. Got it.
Yes, ma'am. Okay, so now it is clear to all.
Ma'am, I have a question.
Yes, sir.
Hello. Yes.
Yes, yes.
Ma'am, the hypersensitiveness of bronchial, is it normal or is it due to asthma?
So sensitivity is okay, but hypersensitivity is a little which is creating difficulty or problem. Because hypersensitivity, this is because of the immune system. If low immune system, maybe it will be hypersensitive. As we see in the children's also, some students are very hypersensitive or very sensitive that they easily get cry or they easily get hurted, and some are strong. So like that, I'm saying it
Okay.
hypersensitivity is not good. Hmm. Exact answer
Okay.
for your question is it should be sensitive, but not that much. Hypersensitive is not. Okay, sir. So now it's okay for all. Should we start next disease with first disease of cardiovascular?
No, ma'am. I think tomorrow we will do.
Yes, ma'am. Tomorrow.
Others also answer. Type the question. Some reactions, please give.
For me, okay, ma'am.
How many slides will be there, ma'am?
Hmm. On the basis of slide, you will study.
I mean, if it gets too late tomorrow morning, then classes.
No, okay, we'll do tomorrow because it is a bigger. No, because it will take a time, and we'll start new disease tomorrow. Only 10 minutes have left. Stay here only. I will ask the questions. Okay. So, hmm, who will tell that what is 1 minute? Um, how many type of sinuses are there? Raise your hands.
Four types.
Raise your hands. Okay. Okay. So who will name them? Gunjan ma'am left. Okay. Lipali. Okay. Sarika ma'am will tell the name.
It is frontal, maxillary, sphenoid, ethmoid.
Okay. The one word. Who will tell one word for these all four sinuses together? Yes. Yes. Raise your
And
Paranasal
hands.
sinus.
sinus, ma'am.
Please don't answer like that. Just raise your hands. Okay, you raise your hands. Okay, you're knowing. Okay, very good. Paranasal sinuses. Mm, yes. Now, who will tell that how many classification we have studied in allergic rhinitis? Suja ma'am will tell.
It's seasonal, perennial, sporadic, and occupational.
Yes, very good. What happened in perennial? Sagar sir will tell.
Means throughout the year. Affected this person throughout the year.
Okay. So, who will tell what are the classification of sinusitis? Shravani ma'am will tell.
We have three classifications, ma'am, based on location is one number of location, number of sinuses, and another one is duration of attack. And based on location, we have four, that maxillary and frontal and sphenoidal and
Okay,
ethmoid.
stop. And on the other classification, on the basis of other classification, who will tell? This Sakshi ma'am will tell.
Yes, ma'am. So we have two, that multi-sinusitis and pan-sinusitis, and
Okay.
other one on the basis,
Yes,
yeah,
take.
on the basis
Okay, right.
of time, it's four: acute, subacute, chronic, and recurrent.
Okay. So, what is the meaning of word pan? Sh- Sagar sir will tell. Yes, Sagar sir. Are you there?
Plan.
Huh?
Means repeat these questions.
Pan sinusitis. What is pan sinusitis?
It, I
You
didn't.
know or not?
I cannot speak.
Okay. You know or not? Say no, yes.
Not.
Okay, Rajeshwari ma'am will tell. What is pan sinusitis?
Ma'am, pan sinusitis, almost all the sinuses are involved.
Okay. So, can you name those sinuses or their positions?
Uh, uh, Maxillary, ethmoidal,
What is the position
maxillary.
of maxillary?
I'll try, ma'am. Maxillary, located under the eye. Frontal means, as the name suggests, above the eyes in the front. Ethmoidal is between the eyes, and sphenoidal is behind the eyes. I don't know if I pronounced it right, ma'am. Sphenoidal.
Yes, sphenoidal. So, who
Sphenoidal
will?
is behind
Yes,
the
ma'am. Very
eyes.
good. Very good. Very good. Who will tell that which one is butterfly shape related to something butterfly shape bone? You can name the bone. Shravani ma'am will tell.
Sphenoidal bone, ma'am.
Yes, very good. Okay, so done. What exactly is sinusitis? Suja ma'am will tell.
It is the inflammation of sinus cavities.
Okay, what are the sinuses? Who will tell? Raise your hands. Okay, Sagar sir will tell. What are the sinuses? If you don't know answer, please say no. But don't take time,
No,
ma'am.
ma'am.
Only okay, Lepalika ma'am will tell. What are the sinuses?
Ma'am, just now Suja ma'am is gave answer, means sinusitis is the inflammation
Not
of.
sinusitis, not sinusitis. I'm not asking about sinusitis. I'm asking what are the sinuses? What is sinuses?
Okay. So cavity, ma'am, what are the located on the upper respiratory tract.
Okay, your voice is not clear. Saket sir will help. Okay, ma'am. Okay, no problem. You can mute.
Now, sinuses are the cavities that are sinuses are the cavities which are found in our bodies, like in our frontal bone and our ethmoidal bone and
Okay.
sphenoid bone
The
and
one
maxillary
word
bone.
I told now, one word answer you can learn. So
Cavity.
air-filled sacs. These are air-filled sacs. Okay.
Okay.
Okay. So very good. Now who will tell that mm, what exactly happens in chronic bronchitis? Rajeshwari ma'am will tell.
Ma'am, basically, uh, how
Yes.
do I tell, ma'am? There is tightness in the um, mm, I'm not
Tightness
able
in
to
hand,
see.
in legs,
It's a
head.
yeah. No, 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 ma'am. In the lungs, ma'am. In the lungs, in the whatever bronchioles or bronchi, there is tightness. There is tightness, and they are not able to breathe, ma'am. Inflammation and excess mucus, ma'am. Basically,
Okay,
I
the
don't
one
know
reason I
scientifically. I'm
told.
not able to explain.
Okay, ma'am, mute. One reason I told in this that when this happens, who will clearly told. Sarika ma'am.
So it is the uh, lung condition that which destroys the cilia in the airway, and
Yes,
it is causing inflammation and swelling
yes.
in the
Okay.
airways.
Okay, very good. Now the main classification you all know, very easy. Acute and chronic. Now next. So what are the classification of bronchial asthma? Who will tell? Raise your hands without turning your pages. Okay, Sagar sir will tell this. Please speak.
Ask the question.
Mute. No problem. Suja ma'am will tell. What are the classifications of asthma?
It's again acute and chronic, ma'am.
Okay. Asthma.
Yeah, if it is more than few weeks, 4 weeks, it is chronic, and if it is less than 4 weeks, I don't remember exactly.
Sakshi ma'am will tell.
Ma'am, is it those three? Inflammation, mucus, and bronchospasm? Spasm, I don't
No,
know.
actually classification. Actually, that are the conditions due to which this caused it. Okay, three reasons because of which this happens. But types and classifications are same na. So types of asthma, types of classification of asthma on the basis of
Okay,
severity of the
okay.
symptoms. Intermittent, we have
Seasonal,
connected that also.
yeah. Seasonal,
Okay, hmm.
perennial, and irregular.
Based on time of the attacks, Rajeshwari ma'am will tell how many types of asthmas are there.
Ma'am, I have written only seasonal and perennial.
Yes, and irregular also. Okay, Sarika ma'am will tell on the basis of severity of the symptoms how many like classifications are there. Already has told. Sakshi.
Intermittent, persistent.
Okay. What are the three conditions which make our airways to narrow down? One by one, I will ask. First one will tell Sagar sir. Raising your hands. Fast
Comment
answer.
seasonal,
Huh?
perennial, irregular.
What are you telling this one?
The times of attack.
Okay, that is okay. Now I'm asking the reason due to which there is narrowing down of the passage of your airways. Three reasons. First reason you have to tell. Only first reason. Fast, sir. You can.
Mm,
Okay. Saket sir will tell.
Bronchospasm.
Yes. What happens in bronchial spasm? Lipalica ma'am will tell.
Ma'am, muscles will tighten, means the airway tract will be tightened by the mucus, or we can
What will happen on tightening of the muscle? Suja ma'am will tell.
But then the airflow will be less reduced,
Narrowed down.
narrowed.
So air will be not easily travel in and out. Okay, second reason for narrowing down of the passage, Sarika ma'am will tell.
Inflammation, ma'am.
Okay, inflammation in what? Hand, head, eyes, ear.
In the airways, which due to the swelling.
Yes, inner lining of the mucosal lining maybe. And third reason will tell this Sakshi ma'am.
Ma'am, mucus production.
Yes, mucus production. Why mucus is produced? As a reaction to some stimuli. Okay.
Allergies.
Yes, as a reaction to some stimuli, maybe allergens, maybe viruses, maybe infections, etc. Anything. Okay. So now, um, raise your hand. Without any question, raise your hand. You can answer this. Sarika, ma'am, confidence. No confidence. Saket sir, you will not raise your hand.
No, I didn't get your question actually.
Actually, I didn't ask the question. I'm asking that for my next question, who is ready to answer? Okay, Sagar sir will tell. What is first of all, unmute yourself first. Okay. Now what tell what is status asthmaticus? Fast. Are you searching on phone or what?
Search me.
Searching. Okay, Lipalika ma'am will tell. What is status asthmaticus?
Ma'am, having allergics can raise the tics, developing asthma.
Huh? Rajeshwari ma'am
Ma'am,
will tell. What is status asthmaticus?
So, ma'am, the attack continues more than 24 hours, despite of the administration of the bronchodilators, ma'am.
Okay, what are bronchodilators? Sakshi ma'am will tell.
Broncho.
Bronchodilators
Okay, that which control the the response, the attack.
that want to dilate or expand our these airways. The medicines which are given to expand our airways.
Yes,
Okay,
ma'am.
this
Yes, ma'am.
status asthmaticus can even leads to respiratory failure. Why? Because it is very severe condition, continuing up to above for 24 hours. Okay.
Ma'am, if it will lead to failure of respiratory system, then it can cause death also, right?
Yes, lung failure. We say na lung failure or
Yeah.
asthma attack due to which person died sometime. Na? So, what are the main medical management very commonly we use for this asthma? Sagar sir will tell. Please answer this question at least. Last question. Sagar sir, please tell. Okay. Then Rajeshwari ma'am.
Yes, ma'am. So we
What?
have three types of medical management, ma'am. One, we can use the bronchodilators, we can use the nebulization, and we can use the inhalers.
Yes. So what is the exact definition of bronchial asthma? Who will tell? Raise your hands. Will you try, Sagar sir? Okay, Lipalika ma'am will tell.
Yes, ma'am. Can you repeat the question? I could
What
not
is
get it.
exact definition of What is exact definition of bronchial asthma?
Ma'am, a disease when affected the lungs, that we can say bronchial asthma.
Long is okay, but what exactly happening? In first slide definition.
Okay, ma'am. Means excess mucus in the pathway of airways, so that can swollen the tract. That the cause of bronchial asthma.
Okay, so Sakshi ma'am will tell more clearly.
Ma'am, attacks which occur like uh, continuously or something, problem in breathing,
Okay, one word answer for
oxygen,
this you all have to remember is write it
difficulty
or
in
note it.
regulation,
Yes, recurrent attacks.
difficulty in
Okay,
sleep.
recurrent
Ma'am,
attacks.
I have a question.
Yes,
I have a question. Why it is written that difficulty in exhalation only? Why not inhalation?
like exhalation and inhalation. That only I am using again and again exhalation and inhalation only because I thought that you will get confused with this exhalation. That's why the problem in inhalation and exhalation both because it is a passage for common passage for both. Okay. So one word for this definition is recurrent attacks for difficulty in airways passage. Okay, matlab air in and out or exhalation or
Ma'am,
inhalation.
ma'am, you have said due to reversible narrowing of airways. So what does that mean, ma'am? Reversible narrowing means?
Due to reversible, matlab again and again narrowing down of the air passage. Due to airways passage narrowing down. Reversible means again and again because attacks happens at particular time, not whole day which will happen. Like sometimes attacks happen, the person will get a asthmatic attack. So at that particular time only the that condition I show you diagram na third diagram one that so that in that conditions the at that particular time the more narrowing down of the passage is happening. So reversible again and again it will happen.
Okay.
So, with this, we have completed with all the respiratory disorders along with their management. Next, we'll start with cardiovascular disorder. Okay, is it clear for all? Any problem? Your understanding or not? I'm so
Yes, ma'am.
fast.
For me, I feel